pathophysiology of cancer. Before going to pathophysiology, we will just see the introduction of cancer. It is one of the leading causes of mortality and morbidity in the whole world. And they are a large group of diseases. They are characterized by uncontrolled growth, division, and spread of abnormal cells within the body. There are two types of cancer, that is benign tumor and malignant cancer. Benign tumor, they do not spread, but malignant tumor spreads to other part of the body. There are more than 100 types of cancer, including breast cancer, skin cancer, lung cancer, colon cancer, prostate cancer, and lymphoma. The treatment methods now available are chemotherapy, radiation, and surgery. And the factors which are responsible for change of normal cell into cancer cell. These agents are known as carcinogens. First one is environmental factors: tobacco smoking, unhealthy diet, environmental pollutants, and excess alcohol intake. Chemical carcinogens are nickel and cadmium, arsenic, nitrosamines, benzopyrene, aflatoxins, and reactive oxygen radicals. And physical carcinogens are UV radiation, X-rays, gamma rays. Endogenous factors are genetic mutations, DNA errors, oxidative stress, immune defects, aging. And biological carcinogens are oncovirus, HPV, EBV, hepatitis B and C, and RSV. Bacteria, Helicobacter pylori. These agents are also known as the etiological agents of cancer. For any diseases, there will be some agents which are responsible for that disease. They are known as the etiological agents, or the causes are known as the etiological causes. Classified into following categories. Cancer is classified into following categories. One is carcinoma. This is the most common type. These are arising from epithelial cells that cover or line organs. Example: skin, lungs, breast, and prostate. Then sarcoma. It begins in connective or supportive tissues, including bones, cartilage, fat, muscle, and blood vessels. Then leukemia. Cancer of blood and bone marrow, often involving rapid abnormal white blood cell production. Next is lymphoma. They will be starting in the lymphatic system and immune system cells. Then myeloma. They develop in the plasma cells of bone marrow. Then CNS cancers, central nervous system cancers, occur in the brain and spinal cord. So they are classified into carcinoma, sarcoma, leukemia, lymphoma, myeloma, and CNS. Carcinoma arising from epithelial cells. Sarcoma begins in connective or supportive tissues. Leukemia, cancer of blood and bone marrow. Lymphoma starts in lymphatic system. Myeloma develops in plasma cells of bone marrow. CNS occur in brain and spinal cord. Then signs and symptoms. Very heavy night sweats. Then fatigue. They feel they are weak. Then unexplained bleeding or twitching. We cannot explain the cause of bleeding or twitching. Then unexplained pain or ache. That also cannot be explained. Then unexplained weight loss. Simply losing weight. An unusual lump or swelling anywhere on our body. A new mole or changes to a mole. A mole will be existing. Changes can occur to that mole or a new mole. Skin changes or a sore that won't heal. Sores which will not be healed. Then other symptoms are croaky voice, that is hoarseness, or a cough that won't go away. Then mouth or tongue ulcer that lasts longer than 3 weeks. Other ulcers will heal fast, but this will last longer than 3 weeks. And coughing up blood and difficulty in swallowing. That means in the throat there will be a difficulty in swallowing. Then breathlessness, persistent heartburn or indigestion. Persistent heartburn. The unusual changes to the size, shape or feel of a breast. These are common in ladies, or chest, including nipple or skin changes. Then persistent bloating. and appetite loss, a change in bowel habit such as constipation, looser poo, or pooing more often, and blood in your poo. Unexpected vaginal bleeding, including after sex, between periods, or after the menopause. Then blood in your pee. Then problems in peeing. Then we are coming to anti-cancer drugs, that is anti-neoplastic drugs. There's classified into two classes, that is anti-cancer drugs 1 and anti-cancer 2. Cytotoxic drugs 1 and cytotoxic drugs 2. Cytotoxic means it's toxic to the cell. So unwanted cells, toxic to unwanted cells. In this, there are alkylating agents, platinum coordination complexes, the antimetabolites. Alkylating agents are again classified into nitrogen mustards, ethylenamine, then nitrosoureas, then methylhydrazine, and then alkyl sulfonate and triazine. And examples are nitrogen mustards, metfluoridamine, cyclophosphamide, ethylenamine, thiotopa, nitrosourea, carmazine, domestin, alkyl sulfonate, busulfan, triazines, dacarbazine, then methylhydrazine, procarbazine. Then folate antagonist example, methotrexate, platinum coordination complexes, cisplatin, and purine antagonist, 6-mercaptopurine, thioguanine, pyrimidine, 5-fluorouracil. Then microtubule damaging agents are there. They are vinca alkaloids, taxanes, vincristine, and paclitaxel, topoisomerase 2 inhibitor, etoposide, topoisomerase 1 inhibitor, tipotrexan, and antibiotics actinomycin D, doxorubicin, etc. Then miscellaneous hydroxyureas, L-asparginase, etc. There are anti-cancer drugs 3 also, targeted drugs and hormonal drugs. That is tyrosine protein kinase inhibitor, EGF receptor inhibitors. Tyrosine protein kinase inhibitor example, imatinib. This is erlotinib. Angiogenesis inhibitors example, sunitinib. Proteasome inhibitor example, bortezomib monoclonal antibody, rituximab. Then hormonal drugs are the glucocorticoids, example prednisolone, serums, tamoxifen. Then aromatase inhibitors, letrozole, 5-alpha reductase inhibitor, finasteride, progestin, hydroxyprogesterone, and estrogens, ethinyl estradiol, down regulator, fulvestrant, antiandrogens, flutamide, then GnRH analogs, nafarelin.